Hello, this is Dr. Lewerenz at Longevity Health Institute. Hope this finds you well. You always hear me say that. And hopefully this gives you some insight into something that I found very interesting and unique lately with my practice and patients. So I thought I'd do a video on this to share this so that you can share with others, but also you can be introduced to us. So who are we? Who are we here at Longevity Health Institute and my southern office, Lewerenz Medical Center, Longevity Health Institute, and we're soon going to have one on the west side opening in 2021 in Bloomfield. Who are we? Okay, what do we do? So let me give you a little background. Probably should have done this a long time ago because there's I have a couple thousand patients and I have a couple hundred concierge patients around the country. And I still get this question, and my other practitioners get this question, my staff gets this question about, oh, I didn't know you do that. Oh, Dr. Lewerenz still does that? Oh, I go to this doctor for that. We didn't really do anything. He kind of did the same thing. So I thought this would be a good opportunity to say, hey, let's do a reintroduction, okay? What is our practice? Our practice is a functional, personalized medical practice. It is a medical practice where the rubber hits the road. We do internal medicine. We do real medical care here. Okay, I'm board certified in family practice. I did a residency in emergency medicine and family practice. I did a fellowship in regenerative functional medicine. The only difference here than an internist or a family practice doctor is our approach. Our approach is very unique, okay, and I'm very proud of it, so I boast it, is because I came up with an approach that is almost more of a functional family practice approach to your healthcare, where it takes a systems approach, okay? And my nurse practitioners and PAs that work with me that are wonderful, and I'm always in search for a doctor to join me, and right fit, right person, right seat, they'll be here soon. But that is an approach that really looks at you as a whole. I can't tell you in medicine, in internal medicine and in family practice, where so many pieces, whether you're in the hospital or you have 3 specialists or what have you, the pieces aren't put together, okay? No one's talking, no one's connecting the dots, no one's really looking at you as a whole. You're being looked at as a heart, a brain, endocrine organs like hormonal organs, sex organs, your uterus, pain, you name it, psychological, brain, mind, body stuff, okay? But no one's putting it all together and how these all interact, okay? And that's super, super important, okay? Then we also take an approach here where whatever you come in for, like today I had a new patient who was young, her mother brought her in, she's a patient also, and she was here just for allergies, gluten sensitivity, gut health, and a little bit of a tension issue. And I had to follow up with a patient that here was 45 today, new patient that had hormonal issues, newly discovered high lipids, borderline blood sugars, but just really extremely fatigued and not sleeping. Another patient here today in office, actually treated for gut issues, autoimmune disorder, and had low nutrients, gave her B12 and B complex injectable, and she said, oh my God, that first visit was like rocket fuel. It made a huge difference, okay? And so, why would that happen? But my point is, we treat everything here from colds to cancer, okay? And no, I don't do all specialties, but I give you the right direction. I give you the right path with the interest of you first and foremost, okay, to what is gonna solve and correct your underlying health issue. So the goals that you have are our focus. Then we have some goals, and that is prevention and wellness and protection and regeneration. And whether you're aware of it or not, we're gonna keep identifying and tracking certain patterns in your blood and in your physiology so that we know we're impacting your health, in improving your health as you age, and not what the typical is every year, 2, 3, 5, we get worse, okay? And that's just like today, a 58-year-old man had to do a phone consult, follow up on that. We've actually in 1 year improved his cardiovascular health, carotid plaque reduction 30%, coronary artery reduction 100 points on his cardiac calcium score. And yes, it's not a home run yet, but we hit a double, put it that way. And in next year, we'll get another 100-point reduction or 200-point reduction because we're using methods that regenerate and remove plaque and improve his cardiovascular health. Everything from supplements to IVs to lifestyle to diet, and that's the impact that we can have, okay? How does that happen? Well, because we look at you as a whole. And I can't tell you how often I have patients go, well, I went to my internist and he said I have high cholesterol even though they come here. Yes, that's exactly what I do. I go, oh, because it's a different philosophy. Or I went to my gynecologist and they said that I should never be on hormones. Come on, let's talk real. It's a personalized approach and a wellness approach. We are looking at the details. Our patients don't get cancer. Our patients don't have side effects. Why? Because we look at genetics. We look at methylation and how you detoxify. We look at absorption. We look at gut health. We look at so many other features here than just your standard 5-minute visit. Average US medical visit is less than 7 minutes. Typically it's 4 or 5 minutes, okay? Meaning you get, what's your complaint? What are you here for? Here's your script. Get these done, these tests, see you in 3 months. Reality is that is not enough time to impact your health, to improve your health. I care about you and my patients. I want to impact your health. I want to correct things for you and put you on the right trajectory of good health and lifestyle and thrive, not just survive. That's what we're passionate about. That's what we do here at Longevity Health Institute. So who are we? Well, we are your internist. We are your family doctor. We are your gynecologist, their hormone replacement practice. We are your gut restoration GI doctor. We are your health practitioner and coach and guiding you in diet and lifestyle. We are your functional interventionalist in infusion therapy. But what are we really? What are we really? We're your guide, okay? We're your advocate, okay? Just like any family doctor or any internal medicine doctor, okay? They're doing wonderful, good stuff too. This is a different philosophy approach, complicated tongue twister there, philosophy and approach to actually deep diving into your wellness, okay? Do we treat sick people? Absolutely. Do we treat cancer? Absolutely. Do we treat heart disease, diabetes, obesity, hypertension, colon cancer? We treat all of these things with specialists, with their help, and with their integration in our practice. But we're always looking at you and talking to you as a whole. Okay, so hopefully this makes sense to you. You can share with others. Our concierge, practice here that I run for several hundred patients does wonderful. I spend a lot of time with them, and they get personal attention. And we focus on some real big wellness things like genetic screening, like actually epigenetic screening, how you essentially damage or stabilize your DNA, your gut health and nutrients, cancer screening, advanced cancer screening, okay, improve hormones and improve hormonal balance, help you detoxify, improving your lifestyle and diet, okay, and also, your mindset, okay. I'm not a psychologist. We have a health coach on staff here. That's wonderful. We have a psychologist and a social worker we refer to all the time. But hey, this is huge, and this all matters. So our 6-point model of genetics and hormones, toxins and how you detoxify, nutrients and diet and your absorption at the gut level, hormones, mind-body stress, and pain, structural things, okay? These all matter. They can't just be, oh, we're just gonna treat that, oh, we're gonna treat that. I always say what's most important is of our 6-point model, what is wrong? Because it's like a matrix and they all affect each other, okay? So we don't ignore any of it, okay? A lot of things can be easy. Patients come in all the time with 1 or 2 systems that are off, and we impact it and correct it, okay? But you still have to look at the person as a whole, and that's what we do. So call us your internist, call us your general practitioner, call us your alternative doctor, your functionalist, call us your gynecologist, because we do all the screening and pap smears and female exams also my practitioners do, okay? And we do all the standard testing, MRIs, mammograms, thermograms, ultrasounds, calcium scores, CTs, but we go above and beyond because we always look deeper and want to make sure that you're not just surviving, you're thriving, and you're not just band-aided, but you're actually improving what you're here for in your condition, even if you've been diagnosed with a disease or a condition. So that's who we are, and we love what we do. We get excited about what we do. Me and my practitioners talk about patients and their care every day because we really enjoy it. We make a difference in people's lives. We get cards, messages. Actually today, a big gift basket from a patient that is lovely, and can't say names, but I really appreciate her and her family. They are family to me. I have a lot of patients here that are family to me. I treat you no different here than if you are my flesh and blood. So that's what we do here, and we love what we do, and we'll be constantly bringing you improvement in health and wellness and prevention. So that's me, that's Longevity Health Institute, that's Dr. Lewerenz, and that's my practice here with my nurse practitioners, Alex, Shannon, Lauren, and Naomi. They're all wonderful. Please come and join us in your health quest and improving your quality of life forever. This is Dr. Lewerenz. Be well.